Well, good afternoon, everybody. I just want to begin by extending, again, gratitude to 40 million Californians that over the course of the last number of weeks have not only bent the curve in the state of California, but stabilized it. We have made real progress in this state over the course of the last number of weeks. And that's why I want to just confront the topic that is top of mind. And those are the images we saw over the weekend, the images down in Orange County and Ventura County on our beaches. Those images are an example of what not to see, people, what not to do if we're going to make the meaningful progress that we've made in the last few weeks extend into the next number of weeks. The reality is we are just a few weeks away, not months away, from making measurable and meaningful changes to our stay-at-home order. That is a very optimistic point to emphasize. However, that's driven by data. It's driven by behavior. And as we change our behavior, we can impact the science, the health, and the data. This virus doesn't take the weekends off. This virus doesn't go home because it's a beautiful sunny day around our coasts. The likelihood of having a virus-free world is not realistic in the next number of months. We'll look forward to that day as herd immunity comes into effect and we have a vaccine that we can distribute and make available to hundreds of millions of people across this country, billions around the rest of the globe. Until then, we have to manage it. We have to manage risks. We have to manage and augment our behavior. And that's why I cannot impress upon you more to those Californians watching that we can't see the images like we saw, particularly on Saturday in Newport Beach and elsewhere in the state of California. Look, I'm not naive. The overwhelming majority of our coastline was appropriately advanced, meaning the stay-at-home orders were advanced, the physical distancing, the social distancing on those beaches was appropriate. You didn't see those images in LA beaches and San Diego beaches and Northern California around San Mateo County, up further north towards Eureka, because we had strong guidelines that were not only adopted, but were abided by. And we had local partners that supported those efforts and helped create the conditions on those hard park closures that allowed people to continue to conduct themselves appropriately. Unfortunately, there were these exceptions on Saturday in particular, a little less so on Sunday, and we've got to confront that. And I'm encouraged. I want to acknowledge that Newport Beach. I want to acknowledge their city council. I want to acknowledge the County Board of Supervisors in Orange County. I'm told they are looking to consider some augmentations and some more deliberative engagement to address the conditions and those concerns that were highlighted over the course of the weekend. But I want folks to know this as well. We're doing the same at the state level. The California Highway Patrol with our State Parks Patrol with other partners, and we will avail ourselves to more aggressive enforcement of the stay-at-home order, of the social distancing, of the guidelines and procedures that we expect to be followed all across the state of California. I deeply respect localism. I deeply respect local decision-making. I deeply respect the work that elected officials do all up and down this state of all political stripes. And I recognize your anxiety, and I recognize the pressures. As a former county supervisor, as a former mayor, I understand those local pressures intimately. And I deeply understand the broader public sentiment about their need to get some clarity, get some confidence that we'll go back to whatever modified sense of normalcy that we hope to see, that we'll see that advanced sooner than later. But I cannot impress upon people more. The only thing that will set us back is our behavior. The only thing that will set us back is people stopping to practice physical distancing and appropriate social distancing. That's the only thing that's going to slow down our ability to reopen this economy, our ability to adapt and modify this stay-at-home order. As I said, weeks, not months. If the data continues to be as stable as it has been over the course of the last few weeks, the only thing that can stop that is more images, again, like we saw over this weekend. So I'm looking forward to working with those local government agencies, working much more aggressively on the enforcement side, and continue to believe that we have remarkable capacity in the state to stabilize this curve and make the kind of modifications that all of us are eager to make. Again, none more eager than I am. And I just want to extend to that point. Tomorrow, we will be laying out more detail. Last week, on Wednesday, we laid out details on one of our 6 indicators. That was on the issues of testing, on tracing, on tracking, on social isolation that is done with an economic justice framework and the issues around quarantine. Tomorrow, we're going to break down the number 5 indicator, which goes to our business environment, goes to schools and child care facilities and the like. And again, the hope and expectation is that we'll be in a position in a number of weeks to make meaningful modifications. But again, the data will guide that. The indicators will guide that. And the only thing that can disrupt that, to set us back, to slow down our capacity to start to reopen our economy, is behavior that's inconsistent with the statewide guidelines. So I just want to make that clear up top. And again, just want to thank all the incredible work that was done over the weekend by parks and by our public partners and by large cities that really conducted themselves appropriately and truly did justice to the guidelines that not only they set locally, but that the state of California has set. And we'll have a little work to do to improve upon Saturday in particular, but I'm confident that we can do so. And again, look forward to robust conversations this week in that respect. Also am very honored that we had some robust conversations with state of Nevada and the state of Colorado over the last week. And those 2 states have joined our Western States Coalition. In addition to Colorado and to Nevada, of course, the partnership that was formed a few weeks back with Washington State and Oregon. This now allows all 5 states to begin to work even more closely and more collaboratively. I must say it is a wonderful thing when chiefs of staff, all the governors get on the phone and are comparing and contrasting best practices in real time, are sharing data, sharing information. This partnership has already become very, very meaningful. And I just again want to extend my deep gratitude to Mayor Brown, Mayor Inslee, to Mayor Sisolak, and to Mayor Polis, or rather Governors Polis, Sisolak, Inslee, and Brown for their outstanding leadership and their support in this broader Western States agenda. Also want to update you just briefly on a new strategy that we'll also be employing in terms of getting to the next phase as it relates to meaningful modifications of our stay-at-home order. As you may know, a few weeks back, we announced a new economic advisory body, a new recovery body with some of the best and the brightest minds we can source in the state of California that are advising us on our recovery efforts, short-term, medium, and long-term strategies, long-term around reinventing, reimagining the future. One of the conversations that came out of this task force was the importance of breaking down by sector. We're certainly looking regionally in the state, but also looking by sector and really drilling down on the specific and unique needs of every sector of our economy. In an effort to further that cause and to do so with some transparency, we're inviting the press and others in on a series of digital roundtables that I'll be hosting with leaders in small businesses, medium and large businesses by sector, also bringing in customers and bringing in experts from our advisory committee to help guide the conversations, to really start to break down not just broad strokes, hospitality or retail, but by type of retail, by type of sector within the broader sector of hospitality, bars, restaurants, and the unique nature of dining experiences with tablecloths, without tablecloths, and the issues of bars and restaurants that are combined, issues of different types of licenses and different types of retail, those that could do curbside pickup, those that aren't necessarily afforded that because of the way their physical construction works. Are they in a shopping mall, or are they with multiple other businesses, or on their second floor? All of these things will be broken down, and we'll start to socialize those conversations starting tomorrow, again, bringing the press into those digital roundtables. And again, it's not just about the immediacy of working to get specific language on guidance for meaningful modifications of our stay-at-home order in the short term, but it's really about talking about the future and what that retail experience may look like a year from now, 2, 3 years from now. And so having this dynamic process, these two-way conversations in a more granular level, we think is not only appropriate, but will be absolutely determinative in terms of how and when those guidelines are put out over the course of the next few weeks. And so that was something else we wanted to preview. Again, tomorrow we'll be having that first digital roundtable and inviting people in to participate in that. We're also pleased as well that we made some progress over the course of the last number of days. As you know, I'm apt to remind you of all the N95 masks, procedure masks, and other PPE that we procured. We have distributed some 43.7 million N95 masks to date in the state of California. We have also distributed roughly 3 million procedural masks, or rather 4 million, excuse me, procedural masks. Over the course of the weekend, we were able to procure 3.1 million additional procedure masks. So we'll go from 4 to over 7 million masks that will be distributed. That's very good news, very encouraging news. It's the first large shipment from a new commitment that we had announced a few weeks ago in the state of California. It came in on Saturday. It's in our warehouse yesterday. It's being distributed today and through the rest of the week to critical needs all up and down the state of California. So real progress in that space as well. And again, it's progress, it's data guided by these 6 indicators that will determine how quickly we toggle back, how quickly we make these modifications. Again, that's why it's just so important that we continue the physical distancing. We appropriate ourselves in public by putting on face coverings when we are in contact or proximate to other people, and make sure that we continue to advance our stay-at-home orders. I get the data, by the way, every morning. We have a dashboard that's provided on movement, number of companies we are working with that provide that. We made those public a few months ago. We actually showed some of that data here a few weeks back. It says what we all know. Not only did we see an increase in movement and mobility over the weekend, but we've seen week to week, particularly in the last 2 weeks, a modest increase. The vast majority of you are still socially distancing and are abiding by the stay-at-home order. And not everybody that's moving, even an increase in movement, are doing so inappropriately. But it does suggest, again, that we are seeing movement all across the state of California. And boy, it wasn't just anecdotal, those photographs from those 2 counties and the beaches this weekend. We saw specifically data and movement to the beaches that only reinforced that data from a very statistical perspective. But again, data and science and health will drive our decision-making. And if we continue to make, again, the kind of progress we've made over the last few weeks, in the next few weeks, I think we can be in a much better place than some had imagined and hoped for. But again, let's abide by these rules and abide by these guidances. Let me also just briefly, before I get into the daily numbers, mention one other sector. We've been working very hard on these unemployment insurance claims. Some $4.4 billion has been distributed, $4.4 billion since March 15th, just since March 15th. It's unprecedented amount of money that has been distributed. 4.3 million checks have been cut, and we continue to see claims increase. The rate of growth is a little more modest than we saw a few weeks ago, but again, in record territory. People have rightly commented about the call center needing to be opened up beyond the 8 a.m. to noon. We did so a week ago, 8 to 8, 7 days a week. People then rightly commented they're having a hard time getting, because of the call volume, getting a human being to answer, and have expressed frustration. We have acknowledged that frustration on multiple occasions, and we've leaned in. We announced 1,340 people have been redeployed to help support our unemployment insurance claim process, including supporting the call center. Just for the purposes of additional information and advancing that conversation further, we added 600 additional people to that task in the last few days. Later this week, we will be putting text capacity to answer question by text, so SMS. That will go into place in the next few days. We put a new chat bot up a few days ago on the most frequently asked questions. Again, all about reducing the stress, reducing the volume. I mentioned just before the weekend that we were integrating some of the work around call centers and making sure that we're putting different protocols in place. That substantially started to take shape over the weekend. We're not out of the woods by any stretch of the imagination. Let me tell you why. Just last week, 15 million calls came in to that call center, 15 million. And over 1 million minutes were spent, 1 million minutes with a human being answering questions. So one of the things we recognize we need to do is reduce that call volume. We think the SMS, the texting will help in that effort. These chatbots will certainly, we believe, help in that effort. And we're also looking at some of the rules and regulation to loosen them up in terms of the need to make as many inquiries. That's also an important thing that we started doing late last week into the weekend, and hopefully will be bearing fruit later this week. So just know we get it. We're doing everything in our power to get it done. I'm not going to sit here and complain about old IT systems, except we have an old IT system. And let me just acknowledge head on, that's not the only old IT system in government. Interestingly, this has long been a point of passion for me, large-scale IT procurement. And while we were making some progress over this last year, we recognize we have a lot more progress that needs to be made, including the Department of Motor Vehicles, lest I not remind you of their infamous IT system. These things can't change overnight, but no, we're working day and night to begin to do justice to your expectations and your rightful demands for performance from the state of California and all of our partners at the local level. And we're committed to doing better every single day. So I just wanted to update you on unemployment insurance claims as well. As we do every day, I also want to update you on some trend lines before their headlines as it relates to the data that comes in on the number of deaths, hospitalization, number of positives in the state of California. Over the weekend, we started to see a modest decline from that peak last week in the number of lives lost. Over the last 24 hours, 45 lives lost. Tragic. Again, human beings, not just numbers, not statistic, but encouraging sign nonetheless over the course of the last number of days from that peak into last week. We'll see where it goes in the next few days. Always a point of caution, lagging indicator, but that number down from over 100 just a number of days ago. We did see 1,300 new individuals test positive for COVID-19, but we're also seeing substantial improvement in our total testing. Now over 553,000 tests have been performed in the state of California. We're starting to hit those benchmarks that we laid out to you in terms of substantially increasing our testing. I should just note we're also seeing those benchmarks of commitments I made last week on those 80 new testing sites from OptumServe, first one up there now in Humboldt, focusing on rural Californians, others going out in real time today and through the next week. Also Verily, the partnership with Verily, we talked about a number of weeks ago with Google. They're also focusing on places like East LA, inner city California, not just in the rural parts of the state. So not only are we increasing the numbers of tests, I just want to make sure people understand where we are testing is becoming more appropriate to the needs of 40 million Californians. And so we're trying to meet people where they are as opposed to demanding they meet where we are. Again, a lot of progress in that place, and that progress will certainly help us with those green lights of indicators moving forward with these meaningful modifications of the stay-at-home order that all of us are looking forward to. So that's the number of positives, over 1,300 more in the last 24 hours. The number of hospitalizations, 1.4% increase. Again, we're seeing some stabilization, decrease, modest increase, decrease, modest increase in the number of people hospitalized. The number of people in ICUs basically flat from yesterday, just one individual more than in the last 24 hours in the ICUs. So again, stabilization, but let's keep it that way. That's why I began talking about the beaches. Why run that? I know, I'll say it again, that 90-yard dash. Who does that? And you're so close when you've been making so much progress. Let's just get through this thing together so that we can go so much farther, so much quicker. The worst thing we do is we start sort of rest on our laurels thinking somehow the virus has decided to take a break or go on vacation. Virus is as prevalent as it's ever been. It's as transmissible as it's ever been. Nothing's changed in that respect. The only thing that changed is our behavior for the better, and that mitigated the spread and has provided us the opportunity to build a foundation where we can then begin to make the modifications. And so again, I just want to encourage people to continue in that spirit and advance in that space, 6 feet apart minimum, practicing social distancing, physical distancing, abiding by the stay-at-home, and we'll do our part to make adjustments and amendments when the data shows those green lights and the data provides us the indication that we can move there. Hope it's in the next few weeks. I believe it will be, but that's based on our behaviors in the next few weeks. So let's get there together, and let's get there in a much stronger way than we otherwise could. So that's broad strokes, the updates for the day. And I, again, want to just express great gratitude to all of you that continue to do everything you can to really meet the spirit that this moment requires. And that spirit includes all of you that have signed up for the CaliforniansForAll.ca.gov website to contribute your time, your passion, your expertise to volunteer. It is just a wonderful thing to see those numbers continue to grow and continue to expand in terms of every part of this state, people participating, contributing, supporting their neighbors, supporting one another at this incredibly important time. Let's also keep that spirit of contribution going as well. With that, happy to take questions.
Jonathan Ayestas, KCRA News.
Hi, Governor. Thank you for taking my question. Earlier, you had mentioned that you had possibly wanted to work with law enforcement agencies to be a little more aggressive with any enforcement. At least in our area, we haven't heard of any citations. Does this mean you're wanting to take a step more towards that, or is the goal still education about social distancing guidelines versus enforcement?
Yeah, I appreciate it. No, the predominant focus is education. We did a lot of PSAs. We did paid media. I was very explicit last Thursday, a little bit on Friday, about our concerns and the expectation, particularly in these two counties that had soft openings as opposed to hard closures. And it manifested as we were concerned, though I think because of the great work the state parks and their Parks Patrol and our partners at the local level did, it was mitigated. Look, there were thousands of contacts, particularly on Saturday, substantially less so on Sunday for a multitude of reasons. There were no citations or arrests. There were a few warnings scattered all throughout the state of California. I think that's a better approach. I don't want to be punitive. My gosh, someone has lost their job. Last thing they want to do is walk their dog. They're with their kids. They've got cabin fever, and they just want to take a rest on the beach, and all of a sudden they get a citation. I don't want to see that happen. You don't want to see that happen. None of us do. But if there are people thumbing their nose and abusing it, putting their lives at risk because they're impacting the lives of others, and ultimately setting back the cause of reopening the economy as quickly as we'd like to, I think we may have to do a little bit more. And so I mentioned it a moment ago. Let me mention it again. And to answer your question a little more specifically. We have a all-hands meeting. We have a lot of these meetings, but with this is the principal topic with the Police Chiefs Association, our County Sheriffs Association, CSAC, that's our county partners, and others to see if we can work even more closely together over the course of this next week and the next few weeks so that we can keep this momentum going and not see a setback. Everybody's saying the right things. I think they want to do the right thing, including those local officials that wanted to open up the beaches. I think to their credit, they saw what happened. They've listened to the concerns and some of the criticism that all of us have received. And I think there's an understanding and willingness to work collaboratively together. By the way, it extends not just to enforcement, it's also some strategic considerations. When we talk about hard closures, it's primarily these parking facilities. Soft closures include parking facilities, but you broaden some of the parking restrictions even beyond the formal parking areas. You begin to further the efforts to mitigate a surge of visitors. So there's some other things we can do, and we will be doing a lot more of those things in the next number of days and weeks.
Angela Hart, Kaiser Health News.
Thanks, Governor. On the testing ramp up that you've discussed, you've talked a lot about increasing testing in rural towns and communities of color that have seen inadequate testing. But what we're hearing a lot about is challenges when it comes to testing and the uninsured population. So can you talk about that and to the extent with which California's testing goals are being complicated by lack of health coverage?
Yeah, I have Dr. Galley here could talk more specifically about that. That absolutely should not be an impediment for a multitude of reasons that we have announced, regardless of your status in the state of California. For a multitude of reasons, that should not be an issue. But Dr. Galley can fill in more specifically the blanks in terms of what those actions have been and why he feels confident that that's not an impediment.
Thank you, Governor. We do continue to stand up sites across the state, targeting areas that haven't had enough testing, haven't had any testing in some areas. And certainly as we look at our data, to target those neighborhoods and communities where we know there's disparities in outcomes with COVID-19 to make sure those populations receive the testing in a quantity that they deserve. We're building towards that, and we're making new strides every day. Early on in our response, the governor made some very important moves, indications that our commercial health plans should and will support the payment for COVID-19 testing, regardless of where an individual is or what plan they're a part of. He directed our team at the Department of Healthcare Services, who run the Medi-Cal program, to ensure that no individual Medi-Cal beneficiary would experience any economic harm while they seek testing. We have worked with our clinic partners to make sure that there's clarification on how that billing arrangement and payment arrangement can be made so that we don't have any issues getting an individual tested. And for those who do not have either commercial insurance or Medi-Cal, those who are uninsured, that we make sure that anyone who runs a test on an uninsured Californian is able to get reimbursed adequately, so that does not become an impediment. We expect to see these questions more and more as individual clinics and individual settings that begin to do more testing begin to ask the question, and we look forward to demonstrating how they can get payment for those tests, so that the community message across California is, if you think you need to be tested, especially as we change our prioritization and testing guidelines of who should and can be tested, that there is no impediment to getting that done. We see it as a very important part of opening or modifying our stay-at-home orders in the weeks to come. So we are dogged in working hard with our county partners, health plan partners, to make sure that this and any other testing impediment is cleared.
And Angela, as always, PPE is an issue as well. accessibility testing, but you got to have the appropriate amount of personal protective equipment. And so that's why we continue to work so aggressively to make sure we get these masks in particular, but not just masks, gowns, shields, gloves, and other PPE distributed as quickly and assuredly as we receive them.
Alex Michelson, Fox 11.
Governor, thanks for taking my call. A lot of people, business owners, employees, are grateful for all the government assistance, grateful for all the charity work, but what they really want to do is get back to work. So in terms of what are the types of businesses that you're looking at that could potentially reopen first? Are we looking at maybe retail businesses with proper social distancing? Give employees and business owners sort of a sense of what is to come.
The good news is we'll be laying that out in detail tomorrow. We'll be highlighting indicator 5 of our 6 indicators. That indicator is specific to business. We'll talk regions, we'll talk sectors. We'll lay out a strategy for phasing those things in. As I said, preview based upon the data to date and based upon the importance of continuing to practice social distancing and physical distancing. If the data leads us further and the indicators continue to hold, that in the next few weeks, we'll start making some meaningful modifications, not the next few months. That's why, like I just talked about, the importance of not seeing what we saw this weekend on our beaches, because the only thing that could set us back is our individual and collective behavior.
Stephanie Baer, BuzzFeed News.
Hi, Governor. I had a few questions about the state's contact tracing plans. Is the state working with any tech companies to automate contact tracing through a phone app or other technology? And then last week you said that the state's goal was to build a contact tracing workforce of 10,000 people. How many people has the state hired so far? What are their backgrounds, and how is the state going about paying them?
Yeah, we just announced literally a few days ago, but we did our survey. 22 counties have robust tracing capacity that's already in place. We're building off that existing workforce. We are going to announce, I don't want to get ahead of myself, a partner with a well-known brand in the state of California, but not tech brand yet. This is more a well-known medical institution in the state of California guide our efforts. As I specifically said last week, we had done that survey not just of the counties, but of our existing workforce on allowing people to fill out forms about what their unique skill set is so that we can then redeploy that workforce. That will be redeployed from, again, a bottom-up perspective, building on the existing capacity and the expertise and workforce at the county level, supplementing at the state level, and then building capacity and partnerships, institution that we're very, very shortly going to announce that will be doing the training that's required for the workforce. We're well on our way of meeting our internal goals, and over the next few weeks, you're going to see thousands and thousands of people well on our way to hit that 10,000 goal sooner than actually some of us had even anticipated when we made the announcement last week. And again, that's based upon the extraordinarily robust existing infrastructure that's in place. It may not be total numbers, but it's the quality of those local efforts that are consistent, by the way, even in this crisis. And this is important to remind people. We've been doing contact tracing for years and years and years, decades in the state of California. TB, measles. Substantively, you'll see a lot of work in this space on STDs, some gonorrhea outbreaks in the last number of years, HIV and AIDS brought to a whole nother level. And some counties are more enriched in this space than others. So we're building off that local expertise that already exists and then expanding it with this surge workforce based on the surveys that we had conducted a number of months back, probably almost 2 months ago, 7 or so weeks when this crisis first took shape and we started those surveys. And then we'll augment those efforts through this online portal and training program that we're just about to announce. And I want to do it today, but I don't want to get ahead of myself. And so no, in the next day or two, we'll be even more specific, including the answer to your question on what the tech platform. We have multiple choices in this. I just want to make sure we don't pick one too soon and unnecessarily and lock ourselves in, but we are very close to having that platform set up as well.
David Baker, Bloomberg News.
Yes, hello, Governor. You had last week talked about how the federal government and President Trump in particular had promised the state 100,000 swabs, testing swabs last week, which then got ratcheted back a little bit to 90,000, and 250,000 this week. Did you indeed get the 90,000 last week? Are you assured that you will get the 250,000 coming up this week? And if so, are there any other testing bottlenecks out there in the different bottlenecks you described last week, like with reagents and things like that?
Yeah, thank you. Oh, we received the 90,000, distributed 90,000. Nothing to believe. It's Monday that this week we won't receive 260,000. They're promising to make up for the 10. But when that comes in, I'll let you know, and there's nothing to suggest it won't happen. We'll still need multiples of that, and so by no stretch of the imagination is that enough. Remember, it's not just the total number of tests. We want to continue to increase the number of times an individual is tested, including the types of tests, the serology tests, not just the traditional PCR tests. And therein lies answer to the second part of your question. Every week we tend to shut one concern down. There's another concern that rears its head. And so you're correct. It was for a while reagents, and then it was specifically RNA extraction kits, and then it was swabs and this last few weeks. But there's also transport media, which I mentioned in the survey of the 251 largest vendors that we have, including our private and public labs, our private partners and public labs that continue to be a problem. Remember, I said in that survey, 50 to 55%, the 251 largest testing providers said swabs was the #1 issue. 50% said some of the testing kits, the transport media, the tubes were also a problem. So that continues to be a space where we're doing more and working, not just our federal partners, but working to procure directly those specific supplies. But look, substantial progress is being made, but by no stretch of the imagination does everybody have ample supplies, including, again, PPE, which is critical in terms of making sure that these tests are conducted at an appropriate level. OptumServe, forgive me for being a little more long-winded, but I want to be precise. OptumServe and those 80 sites we announced last week, those are end-to-end tests, all locked in, all fully loaded in terms of supply and diagnostic capacity. And Verily has substantially made progress in the 6 additional sites that we announced last week in terms of their supply chain. So we're confident in those new announcements that supplies for the moment are ample. And I'll remind you the 1.5 million serology tests that Abbott has committed to and we have procured. Those are going to sites where the machines are already in place, and we're confident that those also are fully loaded commitments.
Jeremy White, Politico.
Hey, Governor, thanks for taking my question. I wanted to ask you about the 2 new states that joined the regional pact today, Nevada and Colorado, as you mentioned. The governor of Nevada noted how many visitors from other Western states come to visit Las Vegas, for example. I'm curious to know the regional framework you're contemplating with other governors. Would it potentially include policing the borders between those states, limits on people crossing those borders, depending on how different governors are rolling back or keeping in place these orders?
Yeah, I think, look, you scope a potential. That's a potential. But I can say this just based on my personal conversations with many of these governors, we have not had that conversation. So that is not our current scoping. Frankly, our current scoping is on what meaningful modifications look like, comparing and contrasting conditions at the local level, recognizing the regional variance even within our states. Tomorrow, again, we'll be laying out more detail on our roadmap and our specific indicator number 5 and what the phased-in approach will look like. You'll see conversations that we've had with other governors where we have taken some of their counsel and advice and incorporated into the presentation we'll be providing you tomorrow. It's just a proof point of the collaboration and the sharing of best practices back and forth. But look, if we're at a different phase in this and there's other concerns, I imagine that's a scoping potential of the purpose of the Western States Compact is some consideration and some collaboration, some heads up, some coordination on something along the lines you suggest, but not at the moment.
Final question, Jim Roop, Westwood One News.
Thank you very much. Good afternoon. Governor, I love you. Most people do right now, but I have a question for Dr. Galley, if that's okay.
My gosh, you've broken my heart or not. You've elevated me. So, Dr. Galley.
I'm sorry. Thank you very much. Doctor, we've been seeing a lot of documentation, hearing a lot of information about how the virus lives on surfaces, so on and so forth. But we understand, at least what I've understood now through all of these briefings, is that the virus is a protein, and in a droplet it'll survive for a little bit. Once that droplet dries up, while the virus could be still detected, its DNA would still be there, it's not necessarily infectious. So we have information on how long that virus can live on somewhere, how long it can be detected. But do we have information about how long the virus is actually infectious on these surfaces? Or do I have all of that wrong?
No, thank you for the question. I think it's an important one. Many people are asking. We talk about how it's transmitted from person to person. We're talking about 6 feet apart. And what about the surfaces that person that you don't normally interact with was just standing at? And we are learning more and more about how the transmission of COVID-19 takes place. I think we're learning based on what other countries are publishing in the literature, what we're learning in some of those major epicenters in the states of where they've had many, many cases. And I would say that because we are not 100% certain how it lives on surfaces, whether it transmits off of those surfaces, that we continue to push out those very basic guidelines. Wash your hands frequently. Don't touch your face if you can avoid it, mainly your eyes, mouth, and nose. Make sure you cover your cough. Keep physical distancing as much as possible. Stay at home when you're able to, and if you must, leave your house to go to a necessary essential visit to the store or the pharmacy, to use a face covering, and to keep as far apart as possible. I think as we learn more and more, whether it's an hour on a surface, 6 hours on a surface, whether that transmits and is actually infective, transmissible, and can cause someone to contract COVID-19, we want to be abundantly cautious with all of our citizens around California and giving that consistent, strong guidance of what to do now. As we learn more and more about the science, we will share that with you, try to be clear about what it means and how it might change our requirements or recommendations around how we behave. But for the time being, we continue to stick to the initial message around physical distancing and doing the basic common sense things around covering your cough, washing your hands, and taking normal measures to protect yourself, your families, and your communities.
Thanks for asking the person who went to medical school that question. And let me just extend appreciation to everybody, all the good work you've done to suppress the spread in the state of California. And good work is provide us the opportunity tomorrow to give you an update on our indicator. Again, 6 indicators. We did the update last Wednesday on testing, tracking, tracing, isolation, and quarantine. Tomorrow, we'll be talking about opportunity to begin to modify and potentially for the course of the next few weeks, not months, modifications to the stay-at-home order that go to the question of businesses, and sectors, and regions in the state of California. But that's because of your good work. If the data starts to show different things, the spread is not suppressed, if we go back to our behaviors COVID-19 behaviors too quickly, then these announcements, these guidances, our ability to get back to modified normalcy will simply be delayed. And so, again, it's in the spirit of collaboration, spirit of expectation, and in the spirit that has defined the last few weeks that I just, implore you to continue to do the great work you've done and continue to tell your friends and family, particularly younger folks, that work is not over. The virus is as transmissible as it's ever been. And again, it doesn't take the weekend off. It doesn't take any time off. It is ubiquitous, it is invisible, and it remains deadly. Ask the 45 families who lost a loved one in the last 48 hours. Please, please continue physical distancing, social distancing. Continue to abide by your local and the state guidances, and continue in that spirit of contribution. And as always, I'll end just reminding you, if you feel the urge to contribute your time, your energy, your passion, your expertise, CaliforniansForAll.ca.gov. Take care, everybody.